Welcome to the Next Steps to Leadership with your host, Dr. Stephen Oliver. In each episode, we invite experts to share their passion and their leadership journey to help you in your next steps. You can find this show on YouTube, LinkedIn, Apple Podcast, Spotify, and on our website, hrcvision.com. Now, here's the host of Next Steps to Leadership, Dr. Stephen Oliver.
Well, hello and welcome to everyone. I'm Dr. Stephen Oliver, or known as Dr. O, and welcome to my podcast, Taking the Next Step in Leadership. The purpose of this leadership podcast is about giving some tips, techniques, some ideas for younger and newer leaders. I invite senior leaders to come in and talk about their careers, their stories, some things that they've done great in their career, things that they might want to recommend enhancing as you go forward. This podcast is also not just for younger leaders, it's for any leaders, as we all take different career steps and career changes in our lives. So it's with great pleasure that I welcome Dr. Zafar Anwar. He's a certified registered nurse anesthesiologist at New York Presbyterian Hospital and assistant professor of nursing at Columbia University School of Nursing. He also has a doctorate of nursing practice from the University of Pennsylvania School of Nursing Science, where I also have the honor of doing some teaching. And it's really great to have you here, Dr. Anwar, and we'll go back and forth from doctor to Zafar. So how are you today? How's it going?
Hi, Dr. O. Thank you so much for having me. It was such an honor when we spoke offline about this podcast. And obviously, I've been listening to your podcast. One of my classmates from the 2024 class, in the DNP leadership class, was on your podcast. And when you asked me to be part of it, I was like, oh, wow, this is such an honor. And obviously, you are one of my former professors. So, that's also a great kind of, feeling for me to be asked to do this. Thank you so much.
Well, it's great to have you, and you are such a great student, and you're doing some magnificent things at both New York Presbyterian and Columbia School of Nursing. So I wanted to just start right out, and can you just tell us a little bit about what you are doing at New York Presbyterian as a certified registered nurse anesthesiologist? I'm not sure if everybody knows exactly what type of nurse that is, but what are you doing there in that role? And then we're going to talk about your leadership.
Yes, I'm a certified registered nurse anesthesiologist, or nurse anesthetist. Those names are synonymous, at New York Presbyterian Weill Cornell Medical Center. So I've been a CRNA for about 7 years now, and I've been working at Weill Cornell exclusively. And my role as a nurse anesthesiologist is to provide anesthesia care. My particular specialty has become obstetrical anesthesia and neurosurgical anesthesia over the years, and that's something that I've kind of honed into in my career trajectory. What my job is, for the people who don't know what a CRNA is to provide anesthesia. Part of my role is to see you early in the morning, the first face you're going to see, say hello, and then talk about the anesthesia plan with you as to what kind of anesthesia is the best for you for a particular procedure, what you should expect, what medications we may or may not give, and what your trajectory is going to be from going to sleep to waking up and getting into the recovery room. So I discuss that with the patient, then I go back into the operating room, which has all the bells and whistles of anesthesia care, and which includes the anesthesia machine and the medications. I'll set that all up, and then you would arrive in the operating room, and we would provide anesthesia for you.
That's a great clarification, I think, for a lot of folks that may not know exactly. When I had my last colonoscopy, two nurses were right there to do exactly what you said, explain what was going to happen, and then the procedures and the medicines, and then all of a sudden I woke up in recovery. But that's different. I was going to ask you a little bit about your professorship, but let's go into why you decided to become a nurse Zafar, and then also why you chose anesthesiology. I find that really interesting.
So it came to me on a very personal level. My mother, unfortunately, who passed away from an oncological complication, um, she was in the hospital. This is when I was about 17 or 18 years old. And I remember frequenting the hospital a lot, during that time. And I distinctly remember this, that the days that my mom had a nurse that was kind to her, that was, taking care of her, especially because my mom had a lot of oncological pain associated with her condition. She just had a smile on her face, and and that wasn't frequent enough, especially with her condition. So I knew that there was something special about the nursing profession and what nurses can do for the patient. And that really drove me to the profession. And I'm very lucky to be part of it. To your second question as to why anesthesiology, I think that was kind of a growing thing, which happened throughout my nursing career. So I started in the cardiothoracic ICU step down, and I, worked there. I loved it there. That was my first job in the hospital. And then I kind of, once I felt like I was ready to be part of the intensive care unit, I transferred to medical ICU, and then eventually ended up in cardiothoracic ICU, which was my kind of terminal unit before I pursued to become a CRNA. And I remember during all that time kind of learning the different skill sets from my CTICU step down days to my medical ICU. So I was kind of building up to something. I always knew that I wanted to become an advanced practice nurse. That was something that was very clear to me from the beginning of my career, but I wasn't really sure what my pathway would be. So just kind of as a kind of, a lifelong learner and a very inquisitive person, I when I was in cardiothoracic ICU, I started shadowing different advanced practice nurses. So I shadowed a nurse practitioner, I shadowed a clinical nurse specialist, I shadowed a nurse anesthetist. And for some reason, the role of the nurse anesthetist felt like this is something that I felt most close to, and it kind of, spoke to me. And I think one of the biggest things was that I think the idea to be taking care of somebody at a very vulnerable time in their life. I think nurses in general, we do take care of patients at a very vulnerable time of their lives. But this was just extra. And I felt that I had the skill set, I had the drive, I had the intellect and opportunity to pursue this. So once that day was done, and I vividly remember that day because I got home that night about 8 p.m. at night, and I knew that this is what I wanted to do. I wanted to be a nurse anesthetist. I wanted to take care of patients and provide that anesthesia care.
So that's a great story, and I appreciate you saying that. Any challenges on your pathway to becoming a nurse anesthesiologist and an advanced practice nurse? Any can you think of a few challenges that you faced going through? Because that's a pretty tough journey going in that route.
I think the biggest challenge was financial. I think one of the things that is very tough, and I've heard this over the years, even once I've become a CRNA, even before that, I've heard that how tough it was to allocate 2 to 3 years of your life and not being able to work and just kind of save that money and pay for school. And even, I mean, CRNA schools in general are very financially burdening. Some are, more kind of like more less than others, but clearly like not being able to work for now, especially most programs are doctorate prepared programs. They're 3 years basically. So to not work for 3 years, and especially if you are, a family provider, if you're the breadwinner of the family, if you have other obligations, it definitely posed a challenge for me because I find myself as the breadwinner of the family. So, but I still, what I did, I mean, this is just kind of my story, and everybody had their own journey. But for me, I ended up working 3 jobs. I was literally just working 2 jobs and added a third one, basically 6 months before getting one starting school, because I knew that I was going to need that backup just in case, and that was a big burden for me. And I think the other one, which is, I would say equally, was the fact that I didn't see a lot of CRNAs that looked like me, that sounded like me, that had, my background. And I think that, that in itself, was it a big hindrance? No, because I think that I have a knack of being a good networker and I can, talk to people, but I still felt there was a little bit of an imposter syndrome. And I felt like, initially when I started school, I didn't belong there. But I think in time, and I think I've had amazing mentors and I've met so many people just kind of during my nursing profession, but also during my kind of getting into CRNA school and being in CRNA school, who guided me, who were kind to me, who, were definitely the kind of the epitome of paying it forward, because I couldn't do anything for them, right? But they were kind enough for their time with their with any help that I need and guidance that I need. And so I'm very lucky to have that.
Well, thank you so much for sharing that challenge. And you're right, everyone's challenge is different. Going back to school in nursing and any other type of discipline is not easy financially and time and navigating your family and friends and work. And so you work very hard, and that's great. There is an emphasis in nursing to get nurses to go back to for more schooling. Certainly, the RN to BSN is very popular. We see a lot of those programs. More and more nurses are getting their master's degree. This past fall, I had 30 in a class. And like you said, nursing is predominantly women, and so I had two men in that class, and so it's great to see men in nursing as well. And then, of course, the doctorate of nursing practice or a PhD in nursing is very popular. I'm honored again to teach one class with other nurses in this coming spring, a leadership and human resource related course, the course that you were in. What prompted you to get your doctorate of nursing practice? I'm just curious about that.
I
There we
felt
go.
that it was just kind of the natural transition for me as a person. I'm somebody who wants to go to the next step and to the next step. And so once I felt comfortable as a nurse anesthetist, I felt like the next step for me is to get my doctorate. And there were two goals in my mind when I went to apply for schools. And the goal was to become an educator, which I'm clearly doing that right now. And the other goal is to be part of research when it comes to minority parturients and anesthesia care, because because they're the big, unfortunately, even now, there's a big discrepancy in care and deficiency in care when it comes to minority parturients, and that's also true when it comes to anesthesia care. So, to kind of further that cause, to be part of that, to be able to bridge that gap, was my motivation to go back and get my doctorate.
Well, that too is a long journey. It's tough. I myself have a doctorate, and it's not an easy thing to do, especially when you're busy and working and trying to understand the concepts and write dissertations and do doctoral projects. So it's not an easy thing, but it's such a amazing journey to go through that. Can you tell us just a little bit about what you're teaching at Columbia University School of Nursing? You just kind of alluded to that and spoke a little bit about that. What are you teaching? And part of, as we discuss, your bridging theoretical knowledge with clinical application. And so that's really important to have that theory based on the live applications and make sure that the students are really prepared for complex situations of the field of nursing. What are some of the things that you're teaching?
So I'm a assistant professor at Columbia University School of Nursing. I actually started that role last year, and the first class that I ever taught was anesthesia pharmacology. Obviously, it's a class that goes into a little bit more advanced, because most graduate prepared nurses have a pharmacology class that they have to take, but this is a kind of a higher version of it, and it kind of goes into the anesthesia pharmacology, especially the medications that anesthesia providers are giving day to day, but also, and as drugs change and evolve, to be abreast of that. So that's one class which I teach in the fall, but in the spring, which I taught last spring as well, and I'm going to be teaching a month or so, is the name of the class is Anesthesia Crisis Resource Management, and essentially the class goes through, it's a kind of marriage between simulation, and this is for our senior students who are about to graduate from the anesthesia program, and essentially bring them back because they have immense clinical experience by this time, but to bring them back in the simulation lab and go through different crisis resource management scenarios, and just kind of also give them the didactic knowledge of crisis resource management, the history of it, where it came from, how it how it impacts them, talking about the psychological safety, mechanisms that they could apply while they're in a crisis situation. So it just kind of is it's a very good kind of amalgamation of that, as you said, clinical didactic, which is important, right? Just coming back to the pharmacology class, and I think you alluded to the fact that that kind of bridging that gap between clinical reality and actually having a didactic knowledge. I think the way I teach my class, my pharmacology class, is in that same vein where I introduce students to real life scenarios, and then I talk about the medications, the drugs, and drug dosages, which are equally important. Those things are important. You have to know what medication you're giving. You have to know, especially as anesthesia providers, we have to know them on a molecular level. We should know them because then we can know how it interacts with each patient, because each patient is different. But to bring that back to a real life scenario is something I definitely apply in my teaching.
Well, that's fantastic because I think that applying the real life situation is so critical to the teaching and understanding that theory so the students can definitely apply it directly. You've given us a really nice background of your clinical work and your teaching. I really appreciate that, Zafar. I wanted to just talk a little bit about the theme of the podcast today, service as a leader. As we were preparing, you said several times that you truly believe that nursing is a service profession and position, and that the nurse's ultimate goal is to serve the patient. I added the families, other nurses, other staff, people, who come into the hospital. That really is the goal of nursing. Can you tell us a little bit more about what does this mean to you, service as leaders, or leaders need to have a service orientation?
To me, leadership is not about a position, it's a responsibility. Ultimately, service as a leader means you're putting the growth, the well being, and success of others at the center of leadership. I go back to Robert K. Greenleaf, who is a philosopher that actually kind of describes servant leadership. And to me, servant leadership is not about hierarchy or control, it's about responsibility. If you are entrusted with influence, right? If you're entrusted with a position, your role is to serve others and serve the greater good.
Well, that's fantastic. And if you don't mind, I printed out a definition of servant leadership because that's connected to what you were discussing when we first decided what we were going to talk about. And basically, servant leadership, this is for those who may not understand it or may not know it, but servant leadership is a philosophy where the leader prioritizes serving the team's needs, fostering their growth, well being, and empowerment rather than focusing on personal power or hierarchical control to build trust and achieve organizational success through engaged, highly performing individuals. And the key principles or characteristics are, service first, a natural desire to put the needs of others before yourself, focusing on growth, helping people to grow and learn, empowering, sharing power, sharing authority. You can't do it all as a leader, so how can you share that? Community building, which I feel is so important, fostering belonging, inclusivity, psychological safety where people feel accepted, stewardship, acting as a caretaker or group's resources and interests, and then humility and empathy, leading with selflessness, kindness, and understanding the other's needs, that empathy. And this, to me, I think is so needed in our culture today because so many people want power and they want to be in control. and as I was reading this, I was thinking, what the things that are going on in the news today, a lot of leaders may not want to do this. How far can you serve your employees as the manager, supervisor, leader? How do you serve your employees?
Throughout my career, I felt like I found myself gravitating towards service leaders. I never knew the definition, right? Like, I never knew, and thank you for sharing that, what you just shared. But when I was a, say, baby nurse and a new nurse, I didn't know those definitions. I had, like, I probably like read it in nursing school, but didn't really, put two and two together. But I naturally gravitated towards people like that, as you just shared, exactly the definition you shared, people who are the caretakers of our profession. And I felt that throughout my career, in terms of just every time, every unit that I shared before, how I kind of move from one unit to the other. Every unit, I always found myself gravitating towards people who just had those qualities and naturally had those qualities, right? So just to answer your question, how do leaders kind of serve their employees, as you said, is the number one thing is by removing barriers, any barriers that would not make that happen, right? So that means creating psychological safety. That means actively supporting growth. A servant leader, to me, doesn't focus on control, as you said. It's more about empowerment, so empowering others to make sure that they are the best version of themselves, right? And I think to me, and this is just kind of my own definition, I would say of the different leadership styles, service leadership is the one that to me feels the most self-actualized leadership, because it seems that it doesn't focus on it doesn't focus on the person, it focuses on the people, right? And ultimately that's what true leadership should be, where yes, you are given a position, you're given a title, but what are you doing with it? And how are you um, bringing more people to that profession? How are you bringing more people towards the goodness of that profession? Example, actually, just kind of on top off the top of my head, would be, there, especially in my profession, I found myself that some clinical nurses were very strong clinically, but found themselves maybe having imposter syndrome or just kind of not being able to speak up. And that, at the outlook of it, from a manager's perspective, you would be like, oh, this person maybe doesn't have what it needs to be a nurse that is like productive. But I think the question is, how are we supporting that person? How are we supporting that person? At the end of the day, instead of looking at their quote unquote deficiency, you go, hey, what am I doing to support this person? And am I creating that psychological safety that I mentioned before? So I think those are the kind of the things that I've seen in my experience, and then obviously I practice myself, and I've seen in leaders who I've worked under, and kind of are exemplaries of that.
Well, that's so fantastic. And then just an example to what you said about what does the leader do? How does he or she act as a leader? What are the things that they do? I am beginning a leadership program this week, and I always say to the participants, do your employees know you're away for the day learning leadership topics? And they're like, yeah, they know we're gone. They may be even enjoying that I'm not in the office today. And I always say, well, can you take something back? Take one piece of information from this class back to them. Teach them. I'm teaching you, and you go back and you don't have to give them the whole class today, but one small thing. I had a participant actually take notes, and she would do a summary of notes of each class and send it out in an email to all her staff. I really like that a lot. It's about what do you do as a leader? What are you learning, and how do you take that back and share it with people? So, a challenge, though, as far as you know, is knowing your employees. Why is that so important to know your employees, especially if you're a nurse manager with lots of nurses reporting to you? Why is it important to know your employees, and how do you? What are some examples of getting to know them?
So it's extremely important, right? It's because servant leadership again is inherently relational. You can't serve people effectively if you don't understand their experiences and challenges, right? At the end of the day, and part of that, and just examples of that would be you find yourself in a employee who initially was very engaged in the organization, very engaged in their work, but all of a sudden they're disengaged for some reason. And instead of assuming poor performance, the servant leader might ask, "What's getting in the way? Like, what's the problem here, right?" And ultimately, the way I kind of look at it is this, because I think that in in our kind of healthcare system and the way our system works, we have performance evaluations, we have quarterly, biannually, annually, performance evaluations, and those are important. Those are important for checks and balances. Those are important to make sure that things are getting done the right way. But I also feel like another thing that should be added and could help is kind of an informal conversation with your employee, and that could be whatever time. That could be biannually, that could be annually, that could be quarterly, whatever, however time and time permits for managers, is to get to know them and to get to understand what really engages them, what really they're passionate about, what are they really looking forward to, what do they want to enhance um in their repertoire when it comes to being part of the profession. And just to your point, I mentioned how you were sharing how like some people were taking a day off and taking your class. See, to me, that in itself, for the people who are taking your class, that tells me something. As a manager, I'm going, oh, this person really wants to be a leader. They really want to learn leadership styles. They really want to get ahead. Perfect. How can I facilitate that? How can I bridge those relations within the organization and whatever context I have? And you know what? And you know what happens in these situations? Reciprocity occurs because, hey, I help that person when I want to do something and I have like an idea. They could possibly help me and bridge up because we all know somebody, and ultimately, as coming back to my original sentence that I said, servant leadership is about relations, right? So ultimately, it's about building relationships, and it's about, communicating and building an environment that is essentially productive, but ultimately satisfying for people.
And that's so important, just knowing some of the basics. I mean, I know in one class last semester, one young lady is my daughter is having an operation. So can I have a couple of days off to turn something in? Another young man is I'm getting married. Can I have a couple of days after the honeymoon to turn something in? My mom's sick. My father just passed away. I had a lot of it. And I get it every year. And these are things that you want to be aware of, because if that employee doesn't do their work to the best or they don't show up, you want to know that something's happening. It's important. How does this help with building trust? Any thoughts about that? Getting to know your employee, how does that help with building trust among them?
So trust is a kind of a tricky concept, right? Because trust is ultimately a function of time and experience. Trust builds with time. With time, with consistency, and ultimately with integrity, right? So ultimately, that's how we even build relationships on a personal level, right? With our friends, with our families. So I think it's very important as nurses that we understand that trust kind of is one of the most important things. We are very lucky as a profession that we are considered one of the most trusted professions in the country, and we wear that with a badge of honor, and we should. I think it's a very beautiful honor to have. But let's now bring it to nursing leaders, right? So when it comes to nursing leaders, it's the same thing. And I think trust ultimately um, comes back to me, especially as a nurse leader, is being consistent with your communication, with your knowledge, and also give people that time um, to kind of get to know you also, because trust goes both ways, right? If I am treating you like another cog in the wheel, right? And there's not going to be trust between us, because for the employee, like, well, I'm just another number. I just need to get XYZ done. Let me get that done, and let me get this manager off my back, and that's that story. But and I think part of that also comes back to the energy that we put out there, right? At the end of the day, if you have a energy of, hey, I want you to be the best version of yourself, and I will provide you with that. And sometimes, let's be honest, with the resources, and nurse leaders have limited resources, and that's an unfortunate reality of you know life in general, but within those limited resources, even, are we creating structures and environments that are bringing people in and bringing people towards a place of, again, psychological safety, but also being able to be the best version of themselves? And I think when you put that all together, um, which at times can be challenging, but once you do put that together, and that's the special sauce, and ultimately that will build trust, and that will build consistency, and that will ultimately get you more productivity as within your unit, and bigger as an organization.
And I believe that also takes time, as you mentioned earlier, time and, working with employees and getting to know them and knowing who they are, their strengths and weaknesses. Um, how do you identify some of the strengths, and we say weaknesses, but I also say developmental areas? How do you really get to know the employee and what they're good at and what they need assistance with, and how you can, move them along in their jobs and maybe even up in the career ladder? What are some things you can do?
It's just the way you present yourself as a leader. I think humility, first and foremost, self-awareness of yourself, because I think that once you're self-aware of yourself, you're able to actually look at yourself like, okay, well, this is what I'm good at. Because let's be honest, we're not good at everything. We all have deficiency, we all have things that we're working on, we're building towards. And ultimately, if we can understand that we don't have all the answers, and listening to people. I think a big thing that leaders should be doing is listening, and active listening, not just listening. I think at times will, and I find myself in my various roles in my past and in my present, you find yourself in meetings. We have monthly meetings, or you know quarterly meetings, and we're sitting there and we're just being talked to, but nobody's listening to our kind of concerns. I think in time, and going back to the question that you asked earlier about trust, right? When that environment is created, trust erodes. Ultimately, you feel like, okay, well, I'm just going to sit here every month, every 3 months, every 6 months, every year, and I'm going to be just talked to, and nobody listening to. And I think that is very important to be to and to be present. I think one of the things that happens at my institution is that we try to encourage outside of work social events, whenever it is possible, right? And obviously not everybody can get together, but whoever can. And I think that in itself just kind of, you know, brings people together. People feel comfortable. They're not at work. They don't feel like, they're in an environment where, they have to be on their P's and Q's. They can be open and honest. And I think with it, that open and honesty, the right service leader or the right servant leader, excuse me, will pick up those nuggets and be like, oh, so that's what that person really cares about. That's what that person really is passionate about. And once you gather that, you can either the employee brings it up or you can bring it up in some way, and then you could build something from that.
Any other examples at New York Presbyterian of things that you might do in addition to, employee gatherings, but other things that can help employees grow as far as employee involvement strategies, maybe being on a patient safety committee or learning, more clinical sort of outcomes, and any other things that you can get the employees involved in to help them to grow in examples?
So I have a great example, Dr. O. I and two of my other colleagues who are also CRNAs, we create a clinical ladder for advanced practice nurses, specifically CRNAs at New York Presbyterian. And our leadership, our CRNA leadership, has been such a positive influence for that. They have given us time, they have given us, resources, they've kind of guided us towards it. There's also, because New York Presbyterian is a big organization and there's a lot of stuff that's happening. Nurses, particularly, do have clinical ladders, and that's been well and running for years. But advanced practice nurses, on the other hand, we're still kind of work in progress, and everything takes time. But it's just been such a positive experience to be able to put that forward and be able to get a response like, yeah, we support you. And we like we've gotten support up to the hierarchy of nursing leadership, so it's not just CRNA leadership but also kind of the directors of nursing and so forth. And that is something that I've been part of. It's still a work in progress. We're still working on it. But that's just a very good example of how a positive environment and an example of service leadership goes back to the idea that, hey, we hear you, we listen to you, and we want to support you.
And that's a great example because I think it's so important for organizations to have these systems to help employees to grow and to, just be more positive in their jobs and foster growth and, work towards that community building. I have kind of one final tough question. What about an employee who's not doing so well, or maybe they have gotten in trouble, or they're not completing all their tasks and duties? What might be some things that you do to help acknowledge that and then get them on track, or maybe have them consider finding some other place where they need to be? Have you had any experiences with that or any examples?
So I would say I myself have not had that experience, particularly, but I will say this. I think ultimately organizations have policies and procedures when stuff like that is happening, especially if it's a repeat offense or if it's something that needs to be, especially if it's a patient safety issue or employee safety issue or just kind of an organization safety issue. So those policies and procedures are in place, and I think most organizations have that. But I think what the thing that I would add on personally would just and it goes back to service and servant leadership is to listen to the employee, hear both sides of the story. So let's say if there was a communication issue or there was a particular patient safety issue, kind of environment safety issue, and now you've been told, oh, this employee did this, please talk to them. Great, that could happen. That's part of the manager's job, is to take care of stuff like that. So what do? The first thing you do is that listen to what the complaint is, first of all, and get the entirety of the information from not just one source, but multiple sources to kind of, corroborate certain things. And then talk to the employee and be like, okay, well, tell me your story. Tell me your version of the story. Then, within that, and again, it goes back to psychological safety, right? If, and we've all made mistakes. Every person in every job has made mistakes. And I choose to believe 99% of the people who made those mistakes didn't do it because they were having a malicious intent. They genuinely made a mistake, especially in healthcare, high stress environment, high acuity, decision making, all of that just happens very fast, and unfortunate mistakes can be made. So, and then once you've kind of got all of that information in, then ultimately you can decide, okay, well, this is what happened, this is the process, and then obviously go back to your policies and procedures, which are set up for a certain way. Depends on the severity of the incident. I'm sure there's, certain kind of procedures that need to be implemented. Maybe some, persons could have to be reprimanded a certain way, or some things have to be talked about, they have to be written up, all these different things. But that's okay. Ultimately, what helps is that you've listened to the employee. And if in this case, the if is, if the person truly made a mistake that they made it out of just kind of, because they're human, because to err is human, um they will take that and make themselves a better provider, or make themselves a better nurse, a better leader, if this is a leadership issue. Because I would like to believe, and I think it is true, most of us want to do good for the sake of good. The percentage of people who don't, well, I can't speak for them. And ultimately, like, that's their choice. But for the people that do good for the sake of good and are part of the nursing profession because they truly believe that they're going to make a difference in a patient's life and in the patient family's life, those those kind of people are, and I consider myself one of those people, will always look at it as a learning experience, learn from it, and become better at it.
That's well said. And again, I really love your comments that you said over and over about listening, really truly listening to the person, hear their side of the story. And it connects back to earlier, you talked about ways to get to know a person. And then, certainly work within the framework of your organization's policies and procedures is also so important, treating people fairly. But then you did connect to, the majority of people who go into this profession really want to service patients, families, other staff, to be that service provider. Well, this has been such a great conversation. Far, any final recommendations on being a service leader, or any other final things that you wanted to say?
I would like to say this. I think from my experience, and I found myself in different leadership positions kind of outside of my current work, which is I was one of the board members of Diversity in Nurse Anesthesia Mentorship Program, which was created by an amazing servant leader herself, Dr. Willina Gould. And also I've been part of the National Association of Hispanic Nurses, specifically New York chapter, but also nationally for the past decade and a half. And one of the things that I've always seen in a good leader is that they always have time for people. They always give their time, they always give their energy. Yes, they're also human, and you have to cut them a little bit of slack. But ultimately, I think that's the kind of service leader that I would like to continue to be and aspire to. And those are the people that I found myself gravitating towards.
Well, I can't thank you enough. Our guest today, Dr. Zafar Anwar, certified registered nursing anesthesiologist, CRNA, at New York Presbyterian, and assistant professor, Columbia University School of Nursing. It's been such a great discussion, and I can't thank you enough for coming today and really helping us to understand better servant leadership and really being a servant first, focusing on growth, community building, stewardship, humility, and empathy. It's been a wonderful discussion today. So thank you for coming.
Thank you so much. Appreciate your time.
So I just want to thank everybody for coming to my podcast, Taking the Next Step in Leadership. If you have any questions or would like to get any more information about the podcast and other topics, please feel free to contact me, Dr. Stephen Oliver, through HRC Vision, Leadership Learning, and Human Resource Management Consulting. And if you'd like to learn more about nursing and servant leadership, contact Dr. Zafar Anwar. So thanks very much.
You've been tuning in to Next Steps to Leadership with your host, Dr. Stephen Oliver. You can find this show on YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, hrcvision.com. Thank you for your positive feedback, comments, questions, and for sharing this show with others.